Good morning. Sapphire and I are here today to talk about myasthenia gravis. Obviously, it has something to do with neuro, and but what the heck is it? So, myasthenia gravis is a chronic autoimmune neuromuscular disease caused by interrupted communication between nerves and muscles at the neuromuscular junction. Antibodies will block or alter. And as you look over here on the right, here's our nerve, and this is a normal synapse. So here's the acetylcholine going down to the receptors of the muscle cell. They fit right in real nice. Well, with myasthenia gravis, you're having antibodies come in, and that's these little Y-shaped guys here. They come in and block those receptors, and they can alter or destroy the receptors also. So that means that fewer acetylcholine can get in and activate the muscle. So the upshot of that is that you get a weak muscle contraction and you can fatigue easily because of this. Every person who has the myasthenia gravis, at some point in their life, they're going to have at least one myasthenic crisis. And this is a medical emergency that occurs when the breathing muscles are the antibodies target there, and it weakens the muscles to the point of needing to be put on a ventilator to breathe. It will resolve and all, but it does weaken you. And it's very important to keep the lung muscles strong. The signs. We've got progressive weakness and rapid fatigue of those muscles that are under voluntary control. It worsens after periods of activity, and it improves after periods of rest. So the symptoms, you've got weakness of the eye muscles. So you can actually look like you have Bell's palsy because you'll have one droopy eye. Or blurred or double vision. It can change, there can be changes in your facial expression, difficulty in swallowing, shortness of breath. That would be all the lung muscles, all the muscles helping with breathing have been impaired. Impaired speech and weakness in the extremities, the arms, hands, fingers, legs, even your neck. And it's because of the symptoms of weakness is a common symptom with many different disorders. The diagnosis of myasthenia gravis can be missed or delayed up to 2 years. So it's one of these things that's kind of hard to pinpoint what's happening when you have this.
So what can be done for myasthenia gravis? Well, since there is not a cure for it, we just have to manage patients' symptoms and then treat using inhibitors to enhance the communication between the nerves and the muscles, corticosteroids, and immunosuppressants. They can have IVIG therapy or plasmapheresis, or also surgery to remove the thymus gland. Occupational therapy is another possibility that the patient might need for swallowing difficulties, activities such as brushing hair or teeth, getting dressed, and then speech as needed. It's on a patient-to-patient basis. And then us as PTAs and then physical therapy can be done with a home exercise program, which focuses on different mat exercises. You could do isometrics, breathing techniques, that sort of thing. The main goals that are associated with physical therapy for myasthenia gravis are really aimed at reducing the patient's symptoms that they're burdened with on a daily basis, and then improving their quality of life. Different stress reduction techniques and things such as strengthening, coordination, balance, and then activity pacing, because there is a aspect of the quick fatiguing, and then just keeping in mind patient safety at all times.
Okay, I'm going to jump in real quick just to say that the MG most commonly impacts young adult women under 40 and older men over 60, but it can occur at any age during childhood. And it is not an inherited disease. So here's our patient.
So we chose a patient that was male over 60. So he's a 65-year-old male. He is retired. His diagnoses include myasthenia gravis, chronic pain, facial weakness, and shortness of breath with exercise. But he also has some of the other common symptoms, such as the muscle weakness and that sort of thing. The hobbies that are included for him and activities of daily living include cooking, golfing, and fishing, which all use fine motor skills and a lot of like upper extremity strength.
Okay. So there is also, I wanted to add that there is no cure for myasthenia gravis. Those that have a mild to moderate case of it, most of it is managed by medication. But for the sake of argument, let's just say our patient actually had one of these myasthenic episodes, and he's in need of some respiratory training. The study that I chose is the respiratory muscle training improves functional outcomes and reduces fatigue in patients with MG. This was done at a single center hospital-based prospective study. Out of that, they had 34 cases, so this is relatively small, that were in the study. The first group is the RMT, or the respiratory muscle training group, and there were 18 of those. And what happened was they received home-based RMT training for 12 weeks using a piece of equipment called the Dauphin breathing trainer, and it helps to train the inspiratory and expiratory muscles. The other 16 cases with MG, all of these had the same class, were given the same classification, a class 2 or 3 on the MGFA classification scale. This became the disease control group. They were on medications from their doctors, but they did not participate in the respiratory muscle training. So they just went on status quo without changing anything. All of the subjects before beginning were subjected to neurological exams, pulmonary function testing, and self-administered questionnaires. And then they retested at the end of the 12-week period. The outcomes were measured using a quantitative myasthenia gravis score, otherwise known as the QMG, and a myasthenia gravis composite scale, which is the MGS. The MGC and the QMC outcome measures showed significant improvement in lung function and functional outcomes. The study also showed a reduction in physical fatigue, which is a major component of this, and that can totally influence your quality of life. So by improving, this is a big deal for them to be able to improve the fatigue component. And that was after receiving the RMT for only 3 months. The control group, no change. So the limitations of this study basically is that all of these people were doing their training at home. So they were unable to fully monitor the home-based therapy. And the sample size, like I said, was relatively small, and it was only for 3 months. Also, another component there was no control over the medications that were administered to the patients. But even still, they found significant improvement in all 18 cases. All right.
Another study that we found was a conceptual framework for evaluating impairments in myasthenia gravis. It was a qualitative study, so it looked at a handful of 20 interviews that were extensively done amongst patients aged 29 to 78, roughly a 50-50 ratio of male to female, although it was a little bit predominant in females. And they all had myasthenia gravis. The aim of the study was to conceptualize the impairments as an overall significant measure of disease severity. So what they did is they separated the categories into major themes or groups based on the impairments, and fatigability. So there was ocular, bulbar, and limb and axial muscles. And then they used these smaller severity scales in order to comprise a large or an overall MG impairment composite. They were all patient-reported outcomes, and they used different impairment scales such as the QMGS, the MGC, the MMT or manual muscle test, MMS, myasthenic muscle score. So the findings of the interviews were for ocular, the main symptoms that presented were eyelid drooping and double vision. For bulbar, it was chewing and speaking and breathing difficulties. And then for limb and axial muscles, it was weakness of the arms, the legs, the neck. And then certain triggers that patients reported were any activities that were prolonged, such as sitting, walking, stairs, shortness of breath, that sort of thing. The framework provided a basis for developing maybe a new treatment outcome measure or modification of the current, because some of the scales that are currently used these days for patients with myasthenia gravis only look at certain aspects of their impairments.
Okay.
So if we created a treatment plan for myasthenia gravis, these are some of the major areas of focus that we would be working with as far as goal progression. We want to make sure that we're monitoring vitals, because respiratory baseline and pulmonary interventions are obviously key, especially if the patient were to have a crisis. Different breathing techniques that we could use are pursed lip, diaphragmatic, straw breathing, or an inspirometer. And then patient education, we want to make sure that they know about relaxation, stress management, and activity pacing, different strengthening, which I mentioned earlier, endurance, pain management, and different modalities such as massage, myofascial, heat or ice, and then also gait, balance, posture, proprioception, and then creating a home exercise program that is fit for the patient based on short-term and long-term goals set by the PT.
Okay, so all of this physical therapy treatment here, it would depend on the patient and what they're presenting with, but these are all options within that diagnosis. So here, that completes our presentation. Here are our references, and any questions or comments, please drop us a line. We'd be happy to answer them for you. And thank you very much.
Have a good one.